Medical emergencies can strike without warning, and knowing how to respond can mean the difference between life and death. From heart attacks to fractures, burns to choking, each situation requires quick and proper action. In this guide, we'll go over the most common medical emergencies and the best ways to handle them. Medical emergencies can occur at any time and place, often without warning. Being prepared to handle these situations effectively can mean the difference between life and death. Quick and informed action can prevent further complications, minimize long-term damage, and, in many cases, save lives. From cardiac arrest to severe bleeding, each emergency requires a specific response to ensure the best possible outcome. Cardiac arrest and heart attacks. Cardiac arrest is one of the most serious medical emergencies, occurring when the heart suddenly stops beating. This leads to an immediate loss of consciousness, absence of pulse, and cessation of breathing. Without immediate intervention, death can occur within minutes. In contrast, a heart attack occurs when a blockage in the coronary arteries prevents blood from reaching the heart muscle, leading to intense chest pain, shortness of breath, nausea, and dizziness. In the event of cardiac arrest, the first step is to call emergency services immediately. If an automated external defibrillator AED is available, it should be used as soon as possible to deliver an electric shock to restart the heart. Cardiopulmonary resuscitation CPR must be started right away by performing chest compressions at a rate of 100 to 120 compressions per minute. Chest compressions should be performed until professional medical help arrives or the person begins to show signs of life. For a heart attack, keeping the person calm and having them sit down can help reduce strain on the heart. Loosening any tight clothing and providing aspirin, if they are not allergic, can help thin the blood and improve circulation. If the person becomes unresponsive and stops breathing, CPR should be initiated immediately. Seeking immediate medical care is necessary to prevent further complications. Stroke. A stroke occurs when blood flow to the brain is blocked due to a clot, ischemic stroke, or when a blood vessel ruptures, hemorrhagic stroke. Without oxygen and nutrients, brain cells begin to die rapidly, leading to permanent damage or death. Common symptoms include sudden numbness or weakness, typically on one side of the body, difficulty speaking or understanding speech, loss of coordination, and vision problems. The FAST method is an effective way to recognize stroke symptoms. Face. Ask the person to smile. If one side droops, it may indicate a stroke. Arms. Ask them to raise both arms. If one drifts downward, it could be a sign of stroke. Speech. Have them repeat a simple sentence. Slurred or strange speech suggests a stroke. Time. If any of these symptoms appear, time is critical. Call emergency services immediately. The best course of action is to ensure the person remains calm and still while waiting for medical assistance. Giving them food, drinks, or medication should be avoided, as difficulty swallowing could lead to choking. Quick medical intervention can minimize brain damage and improve recovery outcomes. Choking. Choking occurs when a foreign object, such as food or a small object, blocks the airway, preventing normal breathing. This is a life-threatening emergency that requires immediate intervention. A person who is choking may clutch their throat, have difficulty breathing or speaking, and their face may turn red or blue. If the person can still cough, they should be encouraged to continue coughing forcefully to expel the object. If they are unable to breathe or cough, the Heimlich maneuver should be performed. This involves standing behind the choking person, placing hands around their abdomen, and delivering quick upward abdominal thrusts just above the navel. For infants, gentle back blows and chest thrusts should be used instead. If the person loses consciousness, CPR should be started immediately, focusing on chest compressions to help push air and the obstruction out. Emergency services should be contacted as soon as possible. Severe bleeding. Uncontrolled bleeding can quickly lead to shock and death if not addressed immediately. To stop bleeding, firm and direct pressure should be applied to the wound using a clean cloth, gauze, or bandage. If available, medical gloves should be worn to reduce the risk of infection. Elevating the injured limb above heart level can help slow the flow of blood. If bleeding continues, additional layers of cloth or bandages should be applied without removing the existing ones. A tourniquet should only be used as a last resort if direct pressure fails to control the bleeding, as prolonged use can cause tissue damage. If an object is embedded in the wound, it should not be removed, as it may be preventing further bleeding. Instead, the area should be stabilized, and medical assistance should be sought immediately. Burns and thermal injuries. Burns are classified into 3 categories based on severity. First-degree burns affect only the outer layer of skin and cause redness and mild pain. Second-degree burns extend deeper into the skin, leading to blisters, swelling, and intense pain. Third-degree burns damage all layers of skin and underlying tissues, often causing a charred or white appearance. For minor burns, running cool water over the affected area for 10 to 15 minutes can help relieve pain and prevent further damage. Applying aloe vera gel or burn ointment can provide soothing relief. Severe burns require medical attention, and ice or ointments should not be applied, as they can worsen the injury. The best response is to cover the burn with a sterile dressing and seek medical care immediately. For chemical burns, the affected area should be rinsed with large amounts of water while removing contaminated clothing. If the chemical enters the eyes, flushing with clean water for at least 15 minutes is essential. Fractures and sprains. A fracture is a break in a bone, while a sprain is an injury to the ligaments that connect bones. Symptoms of a fracture include intense pain, swelling, deformity, and an inability to move the affected limb. Sprains cause pain, swelling, and difficulty using the affected joint. Fractures should be immobilized using a splint or by securing the limb in place with a cloth to prevent further movement. If a spinal injury is suspected, the person should not be moved unless absolutely necessary. Sprains can be treated using the Rice method. Rest. Avoid using the injured limb. Ice. Apply ice packs for 20-minute intervals to reduce swelling. Compression. Use an elastic bandage to support the area. Elevation. Keep the injured limb raised to minimize fluid buildup. Seeking medical care is crucial to ensure proper healing and prevent complications. Poisoning. Poisoning can occur from swallowing harmful substances, inhaling toxic fumes, or absorbing dangerous chemicals through the skin. Symptoms include nausea, vomiting, confusion, difficulty breathing, and unconsciousness. If poisoning is suspected, emergency services or a poison control center should be contacted immediately. If the person is conscious, details about the substance should be provided to medical professionals. Inducing vomiting should only be done if advised by a healthcare expert. If poisoning is caused by fumes, moving the person to fresh air is necessary. Skin exposure should be treated by rinsing the area with large amounts of water. Seizures. Seizures can result from epilepsy, fever, head injuries, or medical conditions. During a seizure, a person may experience convulsions, loss of consciousness, or uncontrollable muscle movements. The best response is to move nearby objects away to prevent injury and place a soft item under their head. They should be turned onto their side to keep their airway clear. They should never be restrained, and nothing should be placed in their mouth. If the seizure lasts longer than 5 minutes or occurs multiple times in a row, emergency help should be sought. Allergic reactions and anaphylaxis. Allergic reactions can range from mild irritation to life-threatening anaphylaxis. Anaphylaxis is a severe allergic reaction that requires immediate medical attention. It can be triggered by various allergens, including certain foods such as peanuts, shellfish and dairy, insect stings like bee or wasp stings, medications such as penicillin or certain pain relievers, and environmental factors like pollen or latex. The symptoms of anaphylaxis typically develop rapidly and may include difficulty breathing, swelling of the face, throat or tongue, rapid heartbeat, skin rashes or hives, dizziness, nausea, vomiting, and loss of consciousness. In some cases, the person may experience a drop in blood pressure, leading to shock, which can be fatal if untreated. While waiting for medical help to arrive, the person should be kept calm and monitored closely. If they have difficulty breathing, They should be placed in a sitting position to facilitate airflow. If they lose consciousness and stop breathing, CPR must be started right away. It is important to remember that even if the symptoms appear to improve after the epinephrine injection, the person still needs medical evaluation, as a second wave of anaphylaxis, biphasic reaction, can occur within hours. Hypothermia and heat stroke. Extreme temperature conditions can have severe effects on the human body, leading to either hypothermia in cold environments or heat stroke in excessively hot conditions. Understanding the symptoms and knowing how to respond can prevent serious health complications and even death. Hypothermia. Hypothermia occurs when the body loses heat faster than it can produce it, causing the core temperature to drop below 95 degrees Fahrenheit 35 degrees Celsius. It can result from prolonged exposure to cold weather, immersion in cold water, or wearing wet clothing in freezing conditions. The first response to hypothermia is to remove the person from the cold environment as quickly as possible. If their clothing is wet, it should be replaced with dry layers, and they should be wrapped in warm blankets. Applying heat packs to the chest, neck, and groin can help restore body temperature, but direct exposure to extreme heat, such as placing them in hot water, should be avoided, as it can cause shock. If the person is conscious, warm fluids such as tea or broth can be given to help increase internal body temperature. Immediate medical attention is required for severe cases, especially if the person is unresponsive or has difficulty breathing. Heat stroke. Heat stroke is a life-threatening condition that occurs when the body overheats due to prolonged exposure to high temperatures or intense physical activity in hot weather. It is characterized by a body temperature exceeding 104 degrees Fahrenheit 40 degrees Celsius, confusion, rapid heartbeat, hot and dry skin due to the inability to sweat, dizziness, nausea, seizures, and loss of consciousness. When dealing with heat stroke, the person must be moved to a cooler area immediately. Removing excess clothing and applying cool, wet cloths to the skin can help lower their body temperature. If possible, placing ice packs around the neck, under the armpits, and on the groin can speed up cooling. Hydration is crucial, but fluids should only be given if the person is fully alert and able to swallow. If they become disoriented, lose consciousness, or experience seizures, emergency medical help should be sought immediately. Untreated heat stroke can cause organ failure, brain damage, and death. Drowning. Drowning is one of the leading causes of accidental death worldwide and can occur in swimming pools, lakes, rivers, bathtubs, and even shallow water. When a person drowns, their airway becomes blocked, preventing oxygen from reaching the lungs and brain. Within minutes, unconsciousness can occur, leading to brain damage or death. The first step in a drowning emergency is to remove the person from the water while ensuring personal safety. If the person is still conscious but struggling to breathe, they should be encouraged to cough out any water and take slow, deep breaths. If they are unconscious but still breathing, they should be placed in the recovery position on their side to keep the airway open and prevent choking. Check for responsiveness and call emergency services. Open the airway and check for breathing. If the person is not breathing, deliver 2 rescue breaths. If there is no response, begin chest compressions at a rate of 100 to 120 per minute, alternating with rescue breaths every 30 compressions. Even if the person regains consciousness, medical evaluation is necessary, as complications such as secondary drowning or dry drowning can occur hours later. In secondary drowning, water that enters the lungs can cause inflammation and fluid buildup, leading to breathing difficulties that may not be immediately noticeable. Seeking medical attention ensures that any hidden complications are addressed. Conclusion: medical emergencies can be frightening, but knowing how to respond appropriately can make a critical difference. Whether it's performing CPR during cardiac arrest, stopping severe bleeding, or treating burns, having the right knowledge and training can save lives. Taking first aid and CPR courses can provide the necessary skills to act confidently in emergency situations. The more prepared people are, the safer communities become. Emergencies are unpredictable, but with the right training, anyone can be equipped to handle them effectively. Being prepared for medical emergencies is essential. Whether it's a minor injury or a life-threatening situation, the right response can save lives. Make sure to stay informed, take a first aid course, and always be ready to help. If you found this useful, like, subscribe, and share for more life-saving tips.